Hello and welcome to today's webinar. I am Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar, which is the latest in the fall leg of our 2024 webinar series. If you're new to our webinar series, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers and the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social costs of cancer. To learn more, visit survivornet.ca. Now, this webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, along with a link to the slides provided with this presentation. We'll have a quick Q&A session at the end, but if you would like, put your questions in the chat at the bottom of the screen. And now to introduce our presenter, Dr. Baydoun is an assistant professor of nursing at the University of Regina. His research focuses on improving mental health outcomes for people living with and beyond cancer. Dr. Baydoun has conducted research on how the COVID-19 pandemic has affected oncology populations, shedding light on the psychosocial and financial consequences of the pandemic on individuals with cancer and other chronic conditions. And so with that, I would like to hand it over to Dr. Mo Baydoun for his talk, COVID-19 and Cancer, the Psychosocial Implications.
Hello, Trevor. Hello, everyone. Thank you so much for having me today. I'm an assistant professor at the University of Regina, as Trevor mentioned. I'm a bedside oncology nurse. I worked as a bedside oncology nurse for like many, many years. And currently, my research focuses on the psychosocial well-being of people with cancer. And today, I'll be like sharing insights with you on a topic that is deeply personal for many people, COVID-19 and cancer. Um, and I'm really passionate about this topic because the COVID-19 pandemic changed our lives across the globe, right? But the impact on people with cancer has been different because people with cancer are among the most affected, and they are already struggling, with psychological, emotional, and social challenges. So my talk today will focus on how the pandemic worsened these struggles for people with cancer, and what we can do to help and support cancer survivors. So I'll be providing an overview of the COVID-19 pandemic, its impact on Canadians with cancer. I'll be identifying the barriers that prevented many cancer survivors from receiving the care that they needed during the COVID-19 pandemic. And I'll be proposing strategies to address those psychosocial impacts, focusing on solutions and what we can do to support cancer survivors, what clinicians, what policymakers can do to support people with cancer in future pandemics. So first, let's start, by understanding the broader context of cancer in Canada. Like 1 in 4 Canadians will be diagnosed with cancer during their lifetime. So that's about like 1/4 of the population, right? So, so like cancer is more prevalent than what we think. So for men, for example, prostate cancer is the most common, while breast cancer is the most common among women. Lung cancer is the second most common cancer, for both genders. So again, these statistics remind us that cancer affect a substantial portion of the population, and we really need a strong support system in place to help cancer patients and survivors achieve and maintain a high quality of life. Now imagine, adding a global pandemic to already, um, to the population who is already like vulnerable and might be feeling unwell. So, like a global pandemic can restrict access to care, it can worsen fear and uncertainty. And, this is a reality that was faced by many Canadians with cancer during the pandemic. And here is the pandemic timeline in Canada. So the first confirmed case was in January 2020. And from that point, we experienced multiple waves of infections, and each involved, the emergence of new variants. And in response to the pandemic, we implemented public health measures, including lockdowns, travel restrictions, and mask mandates. And vaccination started as well in December 2020. Now, currently in 2024, over 80% of the population in Canada is vaccinated, but still the virus, left a devastating impact since its emergence. So like over 4 million Canadians were confirmed to have COVID at some point, and more than 45,000 deaths were reported in Canada due to COVID-19. So for people with cancer, they faced significant challenges during the pandemic as they were already, at high risk of severe illness due to, having periods of immunosuppression among other factors. And our healthcare system, faced immense pressure during the pandemic, dealing with problems such as hospital capacity issues, healthcare worker shortage, which made, things even worse for people with cancer. And here are like some research that I would like to highlight. So there is no doubt that the pandemic has affected our mental health. But for people with cancer, it was especially anxious time. So they were more likely to pick up infections like a cold, flu, or virus. And COVID-19 is obviously one of these infections that people can get, and it can cause serious illness. And you all remember, so during the pandemic, we were all asked to stay at home. So there was some degree of social isolation. But if someone was already dealing with cancer, they might be, already feeling vulnerable. And a stay-at-home order potentially caused even more severe anxiety and a perception of social isolation. So, for example, here, according to one study, 76% of people with cancer reported increased fear of contracting COVID-19 due to their immunosuppressed state. 62% were worried about severe illness outcomes if they become infected with COVID. Emotional distress, depression, anxiety were also highly prevalent. 52% of people with cancer experienced feelings of sadness, hopelessness, helplessness, and 35% had an increased risk of developing depression and anxiety disorder. There was also a sense of uncertainty, loss of control that deeply affected, people with cancer. So these statistics provide a clear picture of the psychological impact the pandemic had on people with cancer in Canada. The combination of heightened anxiety, social isolation, overwhelming uncertainty, and anxiety, created a storm that demanded our attention as healthcare providers and researchers. Moving on to disruption to treatment and care. So according to one study, over 44% of patients experienced delays or cancellations of treatments and appointments. And these disruptions they were not just like inconveniences. They had like serious medical and psychological repercussions. Financial stress was also a significant factor. So, for example, 47% of cancer patients in one study faced job loss or reduced outcome. Access to support services was also a challenge. According to one survey study, 31% of patients had problem or difficulty accessing the mental health and support services that they needed. Especially, at the time, people like had to shift suddenly to virtual platforms. And, many people faced barriers such as, lack of technology access or digital literacy issues at the time. So with all these challenges in mind, in 2021, my research has shifted a little bit, and I started to focus on the psychological effects and the social effects of the pandemic on Canadians with cancer, and how we can best support this population. And here I would like to highlight one study in which I sought to understand how the pandemic's psychosocial effects on individual with cancer compared to those with other chronic illnesses, such as heart disease or diabetes. So in this study, what I did is that I analyzed secondary data. So it was a secondary analysis of a large data set. And that large data set was for the eye care study. And the eye care study is a global initiative led by researchers at the Montreal Behavioral Medicine Center to evaluate the global impact of the pandemic. And the eye care study collected data in 34 languages from, participants across the globe between like 2020 and 2022. And in this study, I used a multiple cross-sectional design where I analyzed this rich and large data set to identify differences in psychosocial outcomes between individuals with cancer and those with other chronic illnesses. Survey respondents were categorized into two groups: individual with current and active cancer, and those with other chronic illnesses, including heart disease, lung disease, immunity disease, obesity, depression, or anxiety disorder, right? So we did a comparative analysis of the psychosocial impact of the pandemic between the two groups, people with cancer versus other chronic illnesses. And here are the measures that we used or were used in the eye care survey to assess the psychosocial impact of the pandemic and were analyzed in our secondary analysis. So the eye care survey included the questions about psychosocial health, quality of life, as well as the coping strategies, including negative and positive ones that were used by people during the pandemic. So for the analysis, we mainly used generalized linear models, as most of the outcomes were interval or continuous in nature. In our secondary analysis, we included about 18,000 survey respondents with a mean age of 50 years. So the sample was really global. So we included participants from 175 countries across the globe, right? So this extensive representation provides a perspective on the psychosocial and financial impacts of the pandemic on people with cancer worldwide, right? Including people here in Canada. So this analysis, like having a large sample, a global sample, it allowed us to analyze the impact of the pandemic across different healthcare systems, different cultures, different socioeconomic conditions, making the findings widely applicable and generalizable. 28% of the respondents were male and 72% were female. So, like this reflects higher participation rates among women, and this could be due to several factors. So, for example, the high prevalence of certain cancers among women, such as breast cancer, or it could be a greater willingness among women to engage in surveys, or it could be like a combination of all these factors in addition to other factors as well. So in our sample, 3.8%, about like 4% of the respondents identified as having cancer, and 96% identified as having other chronic condition such as heart disease, lung disease, and diabetes. And this like different like in the percentage was accounted for in the analysis. So the results were really striking, because what we found is that individuals with cancer were more likely than those with other chronic illnesses to report interpersonal conflicts, such as family arguments or feelings of distrust. They were also more likely to experience major life disruptions, including separation or divorce. On top of these relational challenges, cancer patients reported more significant declines in both medical and physical health. Compared to individuals with other chronic conditions, we also found that those with cancer reported greater concerns and challenges during the pandemic. One of the most significant findings was that people with cancer experienced more heightened fear of contracting COVID-19. So people with cancer expressed more worry about becoming infected and a greater fear of dying from COVID-19. Cancer survivors were also more likely to report, psychological, emotional distress, reported more worry over being unable to see family members, to see friends due to pandemic restrictions. The disruptions to medical care was another major challenge. So, for example, many cancer patients experienced interruptions in their appointments, in their treatments that were not even related to COVID-19. They had their medical appointments canceled, which really, impacted their well-being, their care, their treatment, and potentially their treatment outcomes and their cancer prognosis. Our findings also revealed significant financial and coping challenges among individuals with cancer. Financial hardships were obvious. Participants reported difficulties paying rent, paying mortgage, difficulties paying for basic necessities such as food and housing. People with cancer were more likely to report being unable to afford, payments, paying bills compared to those with other chronic illnesses. The coping mechanisms also different. They were also different between these two groups. So individuals with cancer were more likely to adopt negative coping strategies, such as increased alcohol use during the pandemic. So this analysis really showed that the quality of life for many individuals with cancer was severely affected by the COVID-19 pandemic because of increased levels of social isolation, increased sense of loneliness. Our study, doing this comparison provides evidence that individuals with cancer were more prone to reporting difficulties in seeing family members or friends due to COVID-19 restrictions, possibly because of their immunocompromised state. In addition to all these challenges, they were also more likely to report psychological and social problems, including anxiety, depression symptoms, and social isolation. Financial hardship, was also found to be a particular concern in this population. Inability to pay rent, troubles paying for food, general fears of not having enough money were all reported more frequently by people with cancer. So the negative psychosocial outcomes observed among people with cancer in this study, might also explain our finding that, the use of certain negative coping and health behaviors, such as more alcohol use, was significantly correlated with having cancer in this study. Now, where do we go from here? It's obvious that people with cancer had significant psychosocial financial challenges. So based on our findings, clinicians need to recognize and address the unique challenges faced by individuals with cancer. It's obvious that many people with cancer require additional support. There are many evidence-based interventions that can help people with cancer, but they are being not used due to accessibility issues. So for example, cognitive behavioral therapy, exercise, mindfulness-based programs are all interventions that have been found to be effective in reducing distress in different populations, yet they remain underutilized in people with cancer. So really, future efforts should try to make these interventions more accessible to people with cancer. For example, by utilizing online asynchronous interventions that are cost effective and are easily accessible. And this is why, my program of research in the last 2 years have been focusing on telehealth interventions, on ways to make evidence-based interventions more accessible to people with cancer, especially those in remote and rural areas. So it's important, that policymakers as well, prioritize efforts to provide financial support for people with cancer worldwide, not only here in Canada, because, remember, that was a global sample. And financial problems can exacerbate, the emotional and psychological burdens of cancer. So that's another area that need to be addressed globally as well. And in this post-pandemic time, it's important to help cancer survivors maintain a positive mindset, right? And, to be proactive and make sure that people with cancer will have the support they need should another pandemic occur in the future. So the challenges, experienced by people with cancer during the COVID-19 pandemic, intensified feelings of isolation, anxiety, depression, uncertainty, making psychological resilience more important than ever. So it's important to investigate, existing gaps in the system. So gaps in the provision of supportive cancer care services to be more ready for a future pandemic should it happen. So many patients nowadays still face barriers to accessing the care that they need, the supportive care services. So we need to continue to identify key areas for improvement and develop new strategies to make supportive services and mental health care more effective and more accessible, such as, for example, by expanding virtual care options, by increasing support and funding for mental health resources, and by ensuring a holistic approach to cancer care. And this brings us to the end of my presentation today. And I would like to end with this picture of our beautiful campus here in Regina, Saskatchewan. where I'm joining you today. So thank you so much, Trevor, for having me today. And thank you all for, listening to my talk today.
Excellent. Thank you so much. We do have a couple of questions. First one, how often do you see this kind of gender disparity in cancer research? Because that's a pretty big uh, discrepancy with the eye care program, where it's 25% male, 75% female. How often do you come across that in your cancer research?
That's a great question, Trevor. Like generally speaking, especially in psychosocial oncology research, uh, you know, women are more likely to participate than men in such type of research. And this could be like, due to different factors. So for example, my primary area of research when it comes to mental health support and evidence-based interventions to improve mental health outcomes is mindfulness-based interventions. And, we consistently see that, women are more likely to be willing than men to participate in mindfulness-based interventions. And this is an area that we have been trying to address, through, trying new strategies to make these interventions more appealing to men and to people across the gender spectrum, so that, having more like diverse sample in terms of gender and sex, which will enhance the generalizability of our findings.
All right. Thank you very much, Dr. Baydoun. This is very interesting research, very interesting research. And also, I noticed that you did reference CCSN's own work on cancer and our Cancer Can't Wait campaign there. So thank you very much for using us in your work as well to understand this very complex issue.
Of course, my pleasure, and thanks again for having me. And yeah, I look forward, to continue working on this like area of research, and hopefully do our best, to support cancer survivors here in Canada and abroad. Thank you.
Thank you. Now, this is one in a series of webinars that we are presenting this fall. Our next one is actually happening next week. So stay in the loop about webinars, visit our website, or check your email for our e-blast. If you're not seeing our email in your inbox, check your spam folder. We do use a third-party email service. And if you're not seeing it then or there, then you head on over to our website to subscribe, where you can get our newsletter and not miss out on anything that's happening here at CCSN. And that website is survivornet.ca. And all our webinars can be accessed at survivornet.ca/webinar or on CCSN's YouTube channel. And so without any further ado, thank you very much, Dr. Baydoun, and we'll see everyone on the next one.